So why don't we begin? Connie, do you want to introduce yourself?
Sarah Giegel, Bureau of Public Health Statistics, Epidemiology Manager. Marguerite Bureau of Public Health Statistics. Anita Rosa, I'm a data analyst for the Bureau of Public Health Statistics. Ruth Ann Smakels, Rules Analyst, Office Administrative Counsel and Rules.
Matt Jamison, Quality Assurance Analyst, IT Department.
And Joseph Dick, IT Project Manager.
And my name is Rob Bailey. I supervise the Bureau of Public Health Statistics, which handles the abortion reporting. So let's start by reviewing some of the changes to the statute. As you know, the Arizona legislature enacted changes to the abortion statute. We're going to discuss the ones that specifically relate to and impact abortion reporting. And those are covered in Arizona Revised Statute 362161 and following. So I'm just going to read the parts that are different that impact changes to the abortion reporting system from what used to be the case. Under Arizona Revised Statute 362161, abortions reporting requirements, there is a modified section 18 which reads as follows. Whether a fetus or embryo is delivered alive as defined in section 362301 during or immediately after an attempted abortion, and the efforts made to promote, preserve, and maintain the life of the fetus or embryo pursuant to section 362301. So this is an additional requirement that you must report whether or not the fetus or embryo was born alive, and if so, what measures were taken to preserve or maintain the life of the fetus or embryo. Then section 19, immediately following, statements by the physician and all clinical staff who observed the fetus or embryo during or immediately after the abortion, certifying under penalty of perjury that to the best of their knowledge, the aborted fetus or embryo was not delivered alive as defined in section 362301. So if the embryo or fetus was not delivered alive, then there have to be certified statements attached by every person who was present that witnessed it, and they are under penalty of perjury. All clinical staff, I'm sorry. Okay, moving on to later in the statute, section 362301 now has a section B and following. Section B has direct impact on reporting. I'm going to review that as well. It reads as follows. If an abortion is performed and a human fetus or embryo is delivered alive, the physician performing the abortion shall document and report to the Department of Health Services the measures the physician performed to maintain the life of the fetus or embryo. If an abortion is performed and a human fetus or embryo with a lethal fetal condition is delivered alive, the physician performing the abortion shall also document and report to the Department of Health Services the specific lethal fetal condition that was diagnosed before the performance of the abortion and that was confirmed by an examination performed after the human embryo or fetus was delivered alive. That's section B. A little bit further on, there's section D2, which has an impact on abortion reporting. It basically governs who has to be present for the performance of an abortion, and it says at least one person who is trained in neonatal resuscitation is present in the room where the abortion takes place for any abortion performed or at or after 20 weeks gestational age. The reason why this has an impact is because it would mean that abortions performed at or beyond 20 weeks gestational age would have to have at least 2 certified statements submitted. And lastly, to clarify the definition of delivered alive, I'm going to read it. Delivered alive means the complete expulsion or extraction from the mother of a fetus or embryo, regardless of the state of gestational development, who, after expulsion or extraction, whether or not the umbilical cord has been cut or the placenta is attached, shows any evidence of life, including one or more of the following: A, breathing, B, heartbeat, C, umbilical cord pulsation, or D, definite movement of voluntary muscles. So those are the sections of the revised statute which impact and change abortion reporting requirements from what had previously been required. And so since the act was passed by the legislature, the department has been working with the web development team to modify the abortion reporting instruments so that they can handle these new abortion reporting requirements. And we're going to demonstrate for you the modified instrument so that you can see how it's to function and what you're being asked to do. And also be aware that these are not yet active online. They will go active as of tomorrow morning, I believe, right? Okay. So I'm going to turn it over to Matt, and he's going to demonstrate through the web link, the website, and the changes. And then after he's finished, then we'll open it up for questions and discussion.
All right. Thank you, Rob. Yes, as you can see on the screen, I will be going through the process of showing the new functionality. It's not too much that's been added to the website, although I will have to proceed through the entire form on the website just to get the new section. So I will be entering arbitrary information just for testing. We are currently viewing the testing version of the website. So if any information that is entered does not look accurate, please just understand it is just for testing purposes only. Currently logging in as a facility user would log in. On the home page, there is the link to the abortion procedure report, which we will be accessing. There's also the area where you can access reports and view them. There's a column for viewing the report, the report number, which is automatically created by the system, the report date, and the report status. A complete report indicates one that has been fully answered as yes for the new questions. Apologies. Or incomplete if an affidavit still needs to be uploaded to the website. So at this time, I'm going to go ahead and go through the procedure report and enter information in here as needed. If anything is missed, it will be highlighted in red when you go to submit. So you will be told if you've missed any section of the report. Again, arbitrary information is just being selected and entered to quickly proceed through all the existing functionality of the report. Now we have gone through all the existing functionality and have landed at the new section that has been added, the affidavit section. Now, if the fetus was delivered alive, we would select yes. If it was not delivered alive, we would select no. No is where we would have the chance to upload an affidavit. At this point, it is not here because we have not submitted yet, but you will see in just a moment that upon selecting no and then submitting the report, it will say that the submission was successful and that the report number has been created automatically by the system. At this point, we would have the opportunity to continue to the home screen or to upload the affidavit. So we would go ahead, and if we're going to upload at this point, we would select Upload Affidavit. It takes us to the new upload screen, and if you have the opportunity to perhaps have two screens on your workstation, you could actually drag and drop the file into this box here, where it says Drop Files Here, or if you do not have that functionality available to you, you can go ahead and click into the box, and it will open up a section where you can select the file in a PDF form and then upload it to the website. You would click Save, receive another confirmation message that you have selected this report to upload attachments. If it is correct, you would click Yes, and it would upload and tell you that your file has been uploaded successfully. And then once it has been uploaded, you could scroll down to the new affidavit section and see that the report has been uploaded to this file here with the date and the timestamp. And if you needed to upload more affidavits, you could click on the Upload Affidavits button located on the top right of the affidavit section. It would again take you to the screen, and you can upload up to 10 files. We're going to go ahead and just upload 2 right now. And it will show you, again, confirmation and the actions that it's been uploading, and they have been uploaded successfully. And if you scroll again down to the affidavit section, it will show all 3 that have been uploaded. They will not be removed if one has been uploaded. They will just simply stack on top of each other, and so you can view all of them as needed. If you had more than 10 entries showing on the screen, you could move to the next page to show the next amount of affidavits that have been added. So that is how you add a new affidavit once completing the report. If you were unable to add the affidavit at the time of the report completion, you could always go to the home screen and view a report that has not been finished yet. I have started one already that is incomplete, and you can notice that under the report status column, it is labeled incomplete. So I would select that report. It would open up, scroll down to the affidavit section, and then it would tell me to upload the affidavit because that is required for the no. If you don't have the affidavit already available to you, you could click this blank affidavit link here, and it would open up this file with the wording, and it could be downloaded to your computer, and then you could enter your information and then submit it as a PDF back here on Upload Affidavits. And then again, once the affidavit is uploaded, it's successful. We see it in the new affidavit section at the bottom. And then on the home screen, it is now completed. So that is if no has been selected. If yes has been selected, it's not as many steps. I'll go ahead and go through that right now. Again, entering arbitrary information just to move as quickly as possible through this at this time. Okay, now that the information has been filled out in the other areas of the report, you can see that under the affidavit section, we have the yes/no selection box again. If yes is selected this time, there will be a new text box that appears that allows the user to describe efforts taken to preserve the life of the fetus. So that information would be entered here in this text box. And then once that has been entered, you would then fill out the rest of the report to submit it. It would then submit the report successfully with a report number provided again automatically by the system, and you would click continue to finish up. And you'll see now that the affidavit section has been cleared because that report has already been entered. So we would go to home, and the new one that was done would show here as complete. And as for the walkthrough, that concludes this portion of the meeting.
Okay, so a couple further points of clarification relating to the statutory requirements about lethal diagnosis. Those would be entered into the same text box that you just observed for measures to keep the fetus or embryo alive. So you would just have a continuous run of text. Now, this web page is put together fairly quickly based upon the statute. It's still open to modification, and so you, the users, as you begin to use it, we're asking you to provide feedback about its functionality so that if further changes are necessary to make it work better, we can make those changes. The one requirement, though, is that the changes must comport with the law. And I think that's about everything that we have for the presentation. We can now open it up for questions. Does anyone have any questions?
Yeah, hi, I have a question. Just to confirm, no, if you select a no, you still have to do an affidavit?
If you select a no, you must submit an affidavit, at least one. And if the gestational age at the procedure was 20 weeks or above, then at least 2.
Okay, so if it's less than 20 and no, then you submit the affidavit.
Yes. And if it's more than
Okay,
20, then there would be
Then
2.
two affidavits.
Right.
Okay. And sorry, can you just show the no affidavit one more time?
Certainly.
Oh, right now? Did you do
So as we can see, if no has been selected, there is the Upload Affidavits button in the right-hand section of the Affidavits module. And the user would click on that and then either drop or select their file, save it, confirm, and then acknowledge that it has been uploaded successfully. And then you can also go back and see that a new file has been added.
Great, thank you. We're just a little confused what the affidavit for no is.
Would you prefer to see the actual copy of the affidavit?
Yeah, why don't we show a
Okay.
copy of the affidavit?
Thank
Comes
you.
right out of the statute.
Well, you can when you're blank.
So where is that house at?
Actually, you know what? All right, I just need to run through this process really quick. I do not have another incomplete one available. Just take one moment. If you have any other questions for Rob, you can ask them while I proceed through this quickly.
I got on late, so I missed a lot of your presentation. But are you talking about the new regs, and are we able to ask questions about the new regs on this call?
Yes and yes.
Okay, because I have several questions about the regs and their application to inpatients. So for example, if we have a nurse who calls a physician at home and the patient really needs pain medications and the doctor's not there, how in the world are they going to do the exam? And you can't deprive the patient, inpatient, of the needed medications. I just don't know whether you really do intend to apply these requirements to inpatients.
But what regulations do you think we're looking at? Because we're talking about the abortion reporting regulations.
Oh my God! You know what? I'm sorry. I thought this was the opioids. Okay, no. Okay, we're mixing. Okay, sorry.
Oh, sorry.
No, I have a lot of comments about those statutes, but I will hold my tongue.
So we see the affidavit or certified statement text on the screen now, and it comes right out of the statute. The certified statement essentially is a statement that the person was a witness and that the fetus or embryo was not delivered alive. So it reads, I, fill in your name of the witness, observe the fetus or embryo during or immediately after an abortion on, and gives the date, and certify under penalty of perjury that to the best of my knowledge, the aborted fetus or embryo was not delivered alive as defined in Arizona Revised Statute 362301.
Okay, so this is something that has to be filled out for each procedure by the physician?
By every clinical staff person who witnessed the fetus or embryo during or immediately after an abortion procedure.
So can you define that a little more clearly, because there are multiple people involved as far as support staff, RNs, physicians?
Well, the statute limits it to clinical staff. Connie, Kathy, do you want to respond to how we define clinical staff typically?
Clinical staff would be those who are identified in your facility as clinical staff. So that would mean RN, physicians,
Can't hear her.
anyone who participated in that delivery system.
Okay. Did you hear her response?
Yes, I did. I guess I'm just all the HCAs, like. So if a medical assistant is intaking, then that would be the medical assistant, that would be the RN doing the sedation, and that would be the physician.
The RN, the physician, yes. What about, and the medical assistant, yes.
So is it anybody,
Okay, and, oh, go ahead.
is it anybody who's licensed?
I believe so. Clinical licensing, yeah?
Okay, so that, okay.
They're asking
So this
if
is,
anybody.
Can you hear me?
Clinical staff can be beyond,
Hello?
Oh, okay.
beyond just those who are licensed. So anyone who's providing clinical care to that patient directly.
Okay, so the clarification on that point is it's not just limited to licensed staff. It's anybody who's delivering clinical care to that patient directly is clinical staff.
That's my question. Hello? Hello?
Yes. You have a question?
Yeah. So that if you have three people in the room, say a doctor, a resident, and a nurse, an RN, we'd have each one of them fill this form out, and then we would put that in the attachments, the affidavit?
Yes, that's the way it's intended, I think. The statement says that it has to be done by all clinical staff who observe the fetus or embryo during or immediately after the abortion. So there needs to be a separate certified statement for each one of those.
Is there any requirement in the statute that requires that affidavit to retain in the electronic record?
Well, the agency is going to retain them because they're now part of the statutory reporting requirements. So all of these certified statements that are submitted with the report in order to complete the report will be retained as part of our reporting archive.
But is there any requirement that it is retained in the electronic record of the patient in the organization?
I don't think the statute speaks to that.
Okay.
So, well, we get audited, so we're going to need to know that because the state looks at our charts and looks at the consent forms, and if they don't see that, we need to know if we need to retain it. Can you find out specifically for us, please?
Hi, this is Connie Belden, and we will be discussing that as we look at the abortion rules, but based upon the information we know today, anything that you would do for a patient in your facility and provide documentation for generally is required to be maintained in your medical record. So if you look at the medical record rules and regulations, you'll see that any activities or procedures or implementation of any treatment procedures, medications, consents need to be maintained in the medical record. I don't know if there'll be an exception to this or not, but at this point in time, I would encourage you to maintain them until we determine if there's an exception to that.
Okay, thank you for that. Additionally,
Can you all hear me? Hello?
Yes, we can hear you.
Oh, good. Hi, Connie. There seems to be a distinction, though, between having a complete medical record of the services that have been offered and the requirement to report to ADHS. And I would certainly encourage the state to keep that in mind as they develop rules so that we are not required to maintain the affidavits as part of the record or any aspect of the reporting as part of the record, because that seems to be very distinct and separate from the actual care delivered to a patient.
We'll take that into consideration.
Thank you. The other observation that I have in learning of these new things is that really then, if I understand this correctly, we are going to have paper forms available for every person to sign, a mechanism to scan them somehow into a place where then they can be uploaded into this database, which I think when you get into the operational piece, it's just something to consider here, because most of us do use electronic records and we are very paper light. So, so this really adds some serious consideration to get into place here. I don't know even if a lot of places even have scanners at this point or mechanisms to do such a thing. So just putting that out there because it's something that's becoming clear to me as I hear the requirements.
So let me just speak to that. There's a couple points that need to be clarified about why this particular method was chosen. We did discuss other alternatives. The problem is that the statute is clear in requiring a certified statement that is under penalty of perjury. And so in reviewing this with our legal counsel, it was pretty clear that the only way to do that was with a signed statement by each individual. Now, in terms of the difficulties of being able to scan and upload the documents for electronic attachment, we recognize that. If you have challenges with respect to that, you can mail these in. Since they don't contain any confidential information regarding the patient, you could mail these into the department and we would scan them in for you. But the important thing to note is that you will have to note the procedure ID in reviewing the instrument, and we can actually possibly go over this again to show. Once you complete a report, it produces an identifier for that unique report. And you would have to write that identifier on the written affidavit that you're mailing in so that we can properly associate it with the procedure that it speaks to. So why don't you walk through one more time and show them where that number is generated so they can see.
And while you do that, I have one more question. Is an electronic signature with you know, the legal form with date and time acceptable?
So I'm being told that signature is defined in Chapter 10 of the Arizona Revised Statutes as including in the rules as including an electronic signature.
Very good. Okay, thank you.
Is there a requirement of who fills this out?
There's nothing in the statute that speaks to who completes the affidavit, but the signature has to be of the person who is making the certified statement and is under the potential penalty of perjury.
For the whole document or just the affidavit?
For the affidavit. We're ready to show you how that number is generated now if you look at the web screen.
All right, yes, if you can focus your attention on the screen again. After the report has been filled out and you've entered your information in the affidavit section, you would then proceed to the submit form module, enter the name of the person who is preparing the report date, and the checking of the declaration box that has been provided to the best of your knowledge. You would then click the Submit button, and once it has been submitted, it will provide the report number here in this box. So it would be important to keep an eye on this and record that report number. It is somewhat lengthy, but that is the report number as it is. And then you would hit continue or clear out of there. I accidentally clicked outside the box, so it removed it. But that last report that was there, it would also show up on the home screen as well for the most recent one that was just added. That was P27 2017-08-44, 1, 2, 3, 4 zeros and 29. So that would be that report number located there as well.
So then you would note that report number handwritten on the affidavits that you're mailing in so that we could associate them with that report.
Hello, can I?
There's no completion page that is sent, or, because I can see if reports are being simultaneously loaded in, because it's going to be very busy, if you don't catch the number the first time, how do you go back?
That's a really good question, which is why we also instituted on this front page this grid that shows a list of all of the reports submitted for your facility to date, with also the report date, the report number, and the ability to view and review the report. So, that report number that comes up at the end is available off this dash, and you can actually go in and take a look at the records to make sure it's the one that you're looking for.
So if there's, 50 of them, you have to go through all 50 to try and locate your one?
Well, the completion would take place on our end if you're mailing them in. So once we attach affidavits that you've mailed to us, to the report, then the report would be showing as complete.
I'm just saying that if you don't catch the report number right at the end when you're finishing up the report, you forget to catch what the number is before you hit submit, then there's nothing that's sent back to you giving you the report number saying you've completed and here's your report number. It just goes into this general screen, which could be changing constantly, correct?
Yes, but they are also organized by report date and time. You may not see the time listed, but the report date and time are used to sort this list. So if they forgot, it would be kind of a training thing. You'd want to let them know if they forgot to write it down to go right to the dash, and it should be the very first one there. It won't be like buried in there or mixed up. It should be very accessible.
Okay, thank you.
And even if multiple people were entering in, hopefully they'd only have one. They'd have to look through.
Somebody else had a question?
Yes, hi, can you hear me?
Yes.
I work for, I do the Banner Health. I work for Banner Health, and I put all of our abortions into the electronic form. So I'm very familiar with these codes. So what will happen is they'll scan those affidavits to me now. Is that when they let me know that there's been an abortion, the expectation would be that they would scan those affidavits to me, correct? So I can put them in?
Yeah. So
okay.
Then when you're submitting the report, you would have to select the scanned affidavits that relate to that particular procedure for which you're submitting the report and attach them to the report for completing it.
Right. Okay. Okay. Thank you.
So
I
one
have
other
two
point.
questions.
Yeah, let me just throw in a comment here while I'm thinking of it. If you're going to be mailing in affidavits, please keep copies for your records. Sometimes things get lost in the mail. And to assure that we can complete reports, if you're sending them to us to complete and we don't get them, that report is going to remain incomplete until we get a copy of it and are able to attach it.
Okay. So for workflow purposes, can we have multiple signatures on one page?
No, each statement has to have a single signature for the person who's making that certified statement.
Right, but it's only a quarter of the page. Can we make 4 of those on one page so that everyone associated with that patient signs one page?
Yeah, so long as they're clearly separated, I don't see a reason why you couldn't.
Okay, and can we also use the exact same verbiage to put this in our EHR as a form so that it is also easy for our workflow for our staff to sign electronically, and then we would print out a PDF or save a PDF of that page and then upload it with the same verbiage to the affidavit?
Say that again, so I'm sure I caught it all.
Okay, so what I'm thinking is 4 of those sections on a page, everyone who's touched the patient or been involved in their care signs. That's saved as a PDF in the EHR, and then we're able to upload that to the reporting site in the affidavit.
Yeah, that would work. The one potential complication of doing what you're proposing is that if you have a procedure that's performed at or beyond 20 weeks gestational age, the system is going to be expecting at least 2 certified statements, one for the physician who performs the procedure and one for the clinical staff who's there potentially to perform life-sustaining measures for the fetus. And
right. We only go to 16 weeks, so it won't apply to us.
All right, so just be clear that if you're merging the forms onto a single PDF, that you could run afoul of that in the system, where it's expecting 2 and not getting 2.
Okay, great, thank you.
No.
Any further questions?
I have
So
one
let me
question.
clarify, so that if the baby is not born alive, all we need for attachments are from people in the room saying that the baby was not born alive. If the baby is born alive, you need those statements, plus then you need a statement, an attestation from the physician done to maintain the life of that baby, correct?
No. If the embryo or fetus is not delivered alive, then you need the attestation.
Right.
If the baby is born alive, then there are no attestations required. What you do is you fill in the text box that shows what measures were taken to sustain the life of the baby, and if there is a, I forget what it was called, a lethal diagnosis made before the procedure is performed, then you need the report by the physician in that text box that confirms the lethal diagnosis after the procedure. So all of that would go in that box. The statute does not say that there needs to be any attestation in the event that the fetus or embryo is delivered alive. Only if the fetus or embryo is not delivered alive.
Okay, so if it is delivered alive, we need to have the physician's, well, we have to have some documentation from the physician.
Yeah, there has to be a report from the physician documenting measures taken to sustain the life of the fetus, and if there was a lethal fatal condition diagnosed before the procedure, there needs to be, how does it read? A confirmation by an examination performed after the delivery of that lethal fetal diagnosis.
So would the physician make that documentation in the patient, and what we would do is just cut and paste that onto something, onto your form here?
Yeah, we're not saying that the physician needs to actually fill in the report. No, we're saying that the physician needs to generate the report, and that can be reported by the staff who submit the reports on the electronic system.
Okay, thank you.
Hi.
Could that verification
I just have a quick question for clarity as a physician who may be doing that as a neonatologist. So if I am born alive, and just by definition, as of the year 2017, this is a non-viable fetus, I would just have to document that this is a non-viable fetus, and that is sufficient.
You would also have to document what measures were taken to sustain the life of the fetus.
But if the fetus is non-viable and it's lethal, what measures can I take which don't exist other than would pull?
It doesn't say that you have to take measures. It just says that you have to report what, if any, measures were taken.
Okay, what if any? So, and which could be no measures because there are no measures to take. Is that correct?
Exactly. I think the actual wording of it is, I'll read it for you. If an abortion is performed and a human fetus or embryo is delivered alive, the physician performing the abortion shall document and maintain the life of the fetus or embryo. It doesn't say that there has to be any. It just says that you'll report what measures were taken.
Right. Unfortunately, it implies that you have to take measures. So that's why I'm trying to get clarity.
I guess we would say that if you reported that no measures were taken because the fetus was non-viable, that would be a fulfillment of the reporting requirement.
That is my question. Thank you very much.
I do have a question. Couldn't the lethal condition be identified before the abortion based on ultrasound or other diagnostic procedures?
So I'm not a physician.
Yeah, the answer is yes, that could be, but then what happens is I believe the law requires confirmation with the physical
exam. That's what it says. If an abortion is performed and a human fetus or embryo with a lethal fetal condition is delivered alive, the physician performing the abortion shall also document and report to the Department of Health Services the specific lethal fetal condition that was diagnosed before the performance of the abortion, and that was confirmed by an examination performed after the human embryo or fetus was delivered alive.
Okay, thank you.
We did have a chat question.
Yeah, we have a chat question. Why don't you go ahead and read it?
It was asked, does this apply for stillborn babies or just if we are performing an abortion?
Doesn't. What's prom?
So it's like premature rupture of the membrane.
Oh, I see.
So that happens all like banner. We get questions about that. Stillborn, prom babies. But after the, what week is it, 24? So 24-week prom, not born alive or within the minute you do the fetal death certificate. So that those stillborns don't count as abortion.
So tell you what we're going to do. We're going to take this question back to our legal counsel and get a clarification on it. Because it is a kind of undefined area, and not being a practitioner, I don't know what goes on with these things, so I can't really answer that. But we will talk to Administrative Counsel and Rules, and we'll provide an answer to that question as soon as possible.
We have some other chat questions that were missed. This other one said, what is the time frame for completing this forms?
The time frame for completion is the same as the existing time frame. I think it's within 15 days, yeah. There's been no change in the reporting time frame. Any other questions?
So what happens with the data?
We archive it, and we use it to generate the annual statistical reports. So regarding these certified statements, the department plans to archive them. We have no specific use planned. I'm not aware of any reporting requirements that would include them in our annual report.
What did you say about 15 days?
That's the required reporting time frame. Abortion report has to be filed within 15 days of the procedure. That has not changed under these changes to the statute.
Okay, that's what I just wanted to clarify. Thank you.
Is it within 15 days of the procedure or 15 days after the end of the month that the procedure was performed in?
I think it's 15 days from the procedure. Let me see if I can get a clarification on that from the statute. Got right here in front of me.
And this is supposed to go live tomorrow?
Yes. Now, as I said, this is our first best attempt to get this available for you so that you can comply with the law by tomorrow, which is when the law takes effect. But we are open to suggestions of change if you feel that the form is not functioning well or it's creating difficulties. But whatever changes are made will have to comply with this statute.
Is there any way we can have some time to get our practices situated with this change?
In terms of what? Submitting reports?
Yeah, or just submitting the affidavit.
If you're asking me whether I can extend you extra time on the reporting time frame, no, I don't have the authority to do that. But you do have 15 days to produce and attach the attestations to existing reports that are submitted tomorrow or what follows.
Okay.
I'm
thank you.
trying to find the time frames here, and I'm not finding them in the statute. You know where it's specified in the statute what the reporting time frame is?
Are you sending out the affidavit form so that we can have it now?
The affidavit form is on the website, and you can download it from there, or you can actually, when you're doing the report, as was demonstrated, you can bring it up and fill it in and print it out for signature.
Can you direct on your screen where to find that, please?
Yeah, could you?
Certainly. Now, the way the system is currently set up, once you have completed a report with a no answer under the affidavit section, you can go back to the home screen, select that report, and then there would be, under the affidavit section, the blank affidavit link. And I guess if the facility wanted to, they could, because it is a link that can be saved. It could be saved the first time just as a blank one, and then that would be made copies, I'm assuming, to be used for other procedures.
Yeah, can you please send that out to the email that was for this call so that we all have a copy of that?
Forward it to Sunita, and she can forward it to everybody. So
Okay,
clarification on the reporting time frames, that previous question. Under, let me just, Arizona Revised Statute 362161, Section 19B, it says that the hospital or facility must transmit the report to the department within 15 days after the last day of each reporting month. And is the reporting month a calendar month?
Yeah.
Okay, so it has to be, if a procedure was performed in March, then it would have to be submitted to the department by the 15th of April. Right. This takes place mid-August, so you would be able to have up until September 15th to submit reports for procedures starting tomorrow. Are there any further questions?
We did have another chat question that was missed. Apologies for that. It was asked, can you delete an affidavit if you selected an incorrect file to upload at the time? Now, the way the new functionality is working is if you do go to the report or the file upload screen and you were to pick the wrong file and say it was at this point, before you click save, you can click on show report, and that essentially removes that file that you accidentally clicked on. Now, if it goes to the point where you save it, you could still say, is this correct? Say the file at this point you realized is incorrect. You can click no, and again click show report, and that will again essentially erase it from being uploaded. So hopefully those two catches would be sufficient. But if the user did click all the way to yes and uploaded it, that is the system essentially acknowledging that you have confirmed that is the right report. And at this time, there isn't functionality to delete that after it's been successfully uploaded. But hopefully those two catches of seeing it and confirming it will be useful to the user, confirming that they have the right file that they're uploading. But again, if they have gotten to the point where they've clicked save, there is that confirmation screen that pops up saying, is this correct? You can always click no, and then click show report if you want to back out to the report and start the process over.
So if you get to the point where you realize that you've submitted the report and it has a wrong document attached, you can contact us by email and give the report number, and we can reach out to you and figure out which document was attached and actually work with the archiving folks to remove that document. But it's going to be a fairly labor-intensive process to do that.
You just delete the report.
Yeah, the other way would be to delete the report and ask you to resubmit it, but okay.
One other question.
Okay.
You don't require any documentation of the patient of the new state law?
No,
with regard
there's
to
no change.
if the fetus comes out alive, blah, 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 the resuscitation?
What do you mean by documentation of the patient?
That the physician had that inform the patient of the new requirements of the law?
No, there's no requirement in the statute that that has to be reported to us.
Okay, that's good. And then also for, this is only for abortions, correct? So that if a mother comes in naturally laboring at 18 weeks or 19 weeks and ruptured her bag, and she's going to go ahead and deliver, and we go ahead and maybe give her a little Pitocin to help her deliver because she's 7 centimeters, and that baby comes out alive, would that need to be reported?
We're going to get a clarification on that from an administrative counsel and rules. It kind of fits into the same area as the previous question on stillbirth. So I don't want to answer that, but we will get some clarification and send out a response as quickly as possible.
Okay, thank you.
And just to clarify, you are going to send the affidavit out to this group?
Yeah, we'll send it out by email.
Okay, great, thank you.
Now, if there were some folks who tried to get on that weren't able to, apparently the technology has some limits in the number of seats depending on how you get on. So we're recording this session. We're going to post a recording of it on the web page at some point so that those who missed it can go back and view the whole thing and hear all the questions and the answers. And of course, if you have further questions, please feel free to send those to us at the usual email address and we'll respond to them as well. But we still have 5 minutes left. If there are any further questions, we're happy to take those. Nothing further? Okay, I think that concludes this call, and I thank you for participating.